Hi, my name is Kristen Taylor. I'll be giving a brief talk today on the role of the physician assistant in the United States, both in clinical practice and in industry. Let me share my slides with you. Okay, let's get started. For disclosures, I am an employee and stockholder of Smith & Nephew. Today we'll discuss a brief history of the physician assistant profession, how one becomes a physician assistant in the United States. We will review current practice patterns of PAs and also discuss the role of the PA in industry. The physician assistant profession began in 1965 due to a perceived shortage of physicians. Dr. Eugene Stead, the chair of medicine at Emory at the time, created the first two-year physician assistant training program that was modeled after World War II physician training programs, an expedited medical training experience. On October 6th of 1967, the first three physician assistants in the United States graduated and began clinical practice. The American Academy of Physician Assistants was founded in the following year. To become a physician assistant in the United States requires graduation from an ARC accredited master's degree program and requires that you pass a national certifying exam. This is a generalist exam covering all specialties of medicine. To maintain your certification, a physician assistant must complete 100 continuing education units every 2 years and pass an additional general medical recertification exam every 10 years. Physician assistants in the US practice much like a senior resident or fellow training in medicine would look. They are responsible for new patient and follow-up visits, ordering and interpreting diagnostic and laboratory images, performing bedside procedures, or first assisting in the operating room. A typical day for me as a PA in the clinic would involve having between 20 and 25 patients on my list. I would see new patients, perform a history and physical examination, review any diagnostic imaging or laboratory studies that were available at the time, order additional studies if needed, and then render an assessment and plan. If that plan was for conservative management, I would continue to see that patient for either pain medication, injections, for physical therapy prescriptions with follow-up in office until they either improved or became surgical candidates. For those patients that were surgical candidates, we would discuss what surgery I felt would best address their needs, risks and benefits, the perioperative care, physical therapy requirements, and we would schedule a follow-up visit with the surgeon. At that surgeon's clinic, I would present the patient to the surgeon. We would discuss the prior visit and what assessment plan was rendered, and then he would give his opinion and we would all discuss with the patient together. And that is, I think, one of the keys about physician assistant practice is that, you know, whether I was seeing patients independently or whether it was with my attending physician, that there was always close collaboration, close discussion. My attending physician was required to review and sign off on all notes and orders from my patients when I saw them independently. And we would discuss those patients when we had clinics together. In the operating room, physician assistants first assist. The surgeon may not always be present for all aspects of the procedure. Typically in big hospital settings, physicians are in the room at all times, and that was the case for me when I was in practice. Physician assistants also have prescribing privileges for all classes of medications. Although I will say that some states do not allow PAs to prescribe narcotics, but those are very few at this point. When we take a look at the broader the group of physician assistants in the United States, what do PAs look like? What does the profession look like? There are more than 140,000 physician assistants in practice across all medical and surgical subspecialties in all 50 states in the country. It's a rapidly growing profession. It's grown 34% by 2006. And the US Bureau of Labor Statistics projects a growth rate of 31% from 2018 to 2028, which is much faster than other occupations, which average about 7%. The PA field has grown rapidly over the last 10 years. And because of that, you'll see on the right here that 57% of PAs are under the age of 40, as there have been so many new PA programs coming online. 2 out of 3 PAs are female. That's a bit of a change from the origins of the profession, being a typically male profession. PAs also typically have less than 10 years of clinical practice. That's again driven by the fact that there are so many new PA programs in the last decade. When you look at how and what specialties PAs are practicing in, now, unlike physicians in the US, PAs can change specialty at any time without additional recertification or training requirements. Once in the clinic, of course, they have much closer supervision by your surgeon or the team that you're working with until you become truly competent to see patients independently. And I think because of that, excuse me, because of that, you'll see that PAs after graduation will typically stay with the same field for most of their profession after a few years in clinical practice. Most often, PAs are practicing in family medicine, in orthopedic surgery, or emergency medicine. You'll see that constitutes for about 63% of all PA practices. So what does life look like for a PA outside of clinical practice? There's a lot of things that come from a PA or nurse's skill set that become very attractive to industry. We have an in-depth knowledge of the standard of care. We're aware of unmet needs in medicine and ways in which innovation is needed to improve standard of care, to improve patient outcomes. We have knowledge of surgical instrumentation, surgical technique, approaches from experiences in the operating room. We're adept at high-level medical communication, which may make us, well suited for careers in medical writing or communications. In those practices in which PAs are seeing patients independently, they are very knowledgeable of billing practices, which gives them a good starting point for careers in hospital administration or working with insurance agencies. I was involved in clinical research as part of my clinical practice, and that led me to a career in clinical strategy. PAs also require ongoing knowledge of drug mechanism of action, pharmacodynamics, and pharmacokinetics, which can make pharmaceutical careers compelling. So looking at the medical device industry, I had said that I had taken a career in clinical strategy for my prior background with clinical research. And the knowledge of standard of care and unmet needs. I came from a shoulder practice, and in industry entered into the shoulder and into rotator cuff repair, which was a good fit for me. Outside of clinical strategy, clinical operations may be an interesting career opportunity for PAs and nurses, looking at how to design clinical trials, execute clinical trials, regulatory affairs involved in getting new drugs or devices approved in a market. Professional education is a big area for both nurses and PAs alike, as we are a great bridge between industry and clinicians, knowing the language, knowing the unmet needs and the difficulties in practice, and being able to educate nurses, physicians, and PAs on products. Medical science liaison and medical affairs, these are, I think, also really good careers in medical device industry as a bridge between the industry and the clinician to discuss the science behind products or devices, and medical affairs ensuring the safety of those devices on the market or pre-market. Research and development, which is again a sort of addressing the unmet needs of current practice, and then of course sales and marketing careers. But there are various opportunities in which PAs and nurses can continue to benefit patients, although be it not through direct clinical care. And that's where I've found myself in my career. Thank you all for your time, for listening today. And that concludes this presentation.